Hey everybody, I'm Dr. Martha Anne Carr, and I'm the dentist here at our office. And we are in the midst of a global pandemic. And so I wanted to let everybody know what we're doing to help keep you safe and to keep everybody safe. I'm going to go over some of the things that we're doing. It will not be comprehensive because you don't have that kind of time, but it will give you a good overview of what our office is doing to help keep everybody healthy and well. We first start by asking the CDC recommended questions, the screening questions, to make sure that everybody is healthy that enters. We do a touchless thermometer check of temperatures before anybody enters and make sure everybody's well with that. It's a touch-free visit, so whoever is greeting you out at your car will bring you in and open all the doors for you. You don't need to touch anything. They will dispense for you and have you use 80% hand sanitizer and get those hands nice and clean. We will have you do a pre-rinse with OraCare, which is a good disinfecting rinse of your mouth, and it has just gone through some scrutiny and some testing to find out that it is effective against the novel coronavirus, which we're very excited about. We will have everybody wear a mask that enters the building, no exceptions. We will be minimizing any aerosols that will be generated. So if a procedure can be done one way versus another way to minimize those aerosols, we will certainly pick that way. Rubber dams will be used for most dental procedures, and if you've never had one done and you're getting one, we will walk you through every bit of that. Chairside aerosol vacuum will be used, and it is a high volume removal of microdust particles and aerosols. It's a little loud, but it's super effective, and it just helps us to keep the air around you clean. And as many of you have been reading in the news, particles are suspended in the air and they get to stay in the air. So this helps to minimize that and take that all away. We have a prearranged touch-free payment arrangement done, and so that no hand-to-hand exchange is made when you are paying for services rendered. You will be escorted out of the building sweetly and kindly, but that way, again, you don't have to touch any doors, you don't have to touch any knobs, any surfaces whatsoever. The bathrooms, if needed, are disinfected after each use, and we use an industrial disinfecting fogger with hypochlorous acid at a minimum of 200 parts per million in the rooms to disinfect the air and to make sure that anything that wasn't received by our high vacuum suction or the microdust collector is then disinfected in the air. And honestly, this is just some of what we're doing. There is more. And if you'll start to look at your providers, we look a little different than we used to. We're wearing an abundance of protective gear, I'm sure you've heard PPE, personal protective equipment. The reason is not just to protect us, but it is definitely to protect you. We are all abundantly careful to make sure that we are social distancing in our private lives, that we are using masks, that we are taking proper precautions in our day-to-day life when we're not here at the office to help protect our patients. But further than that, we assume that we're infected. So we do everything that we do gearing up to protect you. There's a minimum of personal protective equipment that is requested and required, and we go beyond that. And the reason we go beyond that is because we love our patients. We love you. And so if it's a little uncomfortable, so be it. We're going to do that because that's what you mean to us.
Now that you've seen what we are doing in response to the pandemic, this is what you can do for us. If you can get to your appointment on time, or maybe even come 5 minutes early, so we can go through our patient pandemic response questions and get your temperature and help escort you into the building. Provide us with any changes to your insurance ahead of your appointment, so we can make the appropriate changes to your records. If you have a health savings account, a flexible spending account, provide us with that information ahead of time, or even a credit card that we can put on file to help cover payments and things that insurance doesn't cover. And we can get all that ahead of time. That would be wonderful. Remember to wear your mask and to smile. You may not be able to see us smiling easily, but through our mask and such, but maybe you'll see our eyes smiling and you can smile back. So remember to wear your mask, stop the spread. Take care, stay well, we love you.